Oh, hey family, it's Pastor Mike. Hope all is well. Listen, so grateful for all of you and for all of you joining on this evening to be part of this necessary discussion. I think in this pivotal time, while we are not only still in the midst of the pandemic, but also seeking to make strides to overcome the pandemic, I thought it was critical that we have some discussion, some conversation about not the pandemic per se, but the COVID-19 vaccine. We know in our community that there is some hesitancy with regard to the vaccine, and our community, African Americans in particular, are not getting vaccinated at the rate of many white persons and others. And so we want to have some conversation. There's a national coalition of clergy around the country that are having these conversations, and actually I'm part of a national steering committee that is seeking to really get the good information out there about the vaccine and seek to get as many people, African Americans, Latinos, vaccinated as possible. And so thank you again for joining this very special Tuesday night transformation. And in this conversation, I am not alone. I'm grateful to have two amazing women part of this conversation who I respect dearly and who are part of the larger FCBC family. And also, before I get to that, I want to welcome all of you, not just locally, but welcome you all from everywhere. I had that opportunity today while doing the radio show today with Reverend Al Sharpton to kind of plug tonight's event. So I'm sure we'll have some people from far and near. So don't forget tonight that as you join us, let us know where you are joining from when you get on this. And so welcome again to everybody. But as I was saying, I have on tonight two amazing persons who I respect a great deal and really honor and grateful for their presence as part of the FCBC family. So without further ado, we have tonight joining us. Not only is she one of the trustees of FCBC, but she is the CEO of Harlem Hospital, Miss Ebony Carrington. And then we also have joining us another good friend, Dr. Ida Brown, who is an orthopedic surgeon, and we are grateful for her joining us tonight. Good. Ladies, welcome and unmute. I see the mute buttons on. There we go. So grateful to have you. And as I said before, tonight is really just going to be us having a conversation, and we'll have some general conversation and some very specific issues. And as I told you all before, I'm going to follow your lead because I look at you all as experts on many levels. But I'll start out, and both of you could just answer, and Ebony, you can answer this. Why is it critical for our community to make sure that we do not miss this moment in being vaccinated? And both of you can answer the same kind of questions. Ebony?
Sure. I think you queued this up for us during Watch Night service, Pastor, that there is really a social imperative as well as a healthcare imperative right now, and they've really collided nicely, quite frankly. So why this is important is because during the first wave of the pandemic, the healthcare disparities that put me into the field of medicine were definitely exacerbated. We saw why people of color and how people of color were disproportionately impacted and succumbed to coronavirus. And in this particular space, we have the opportunity to level the playing field in that way. This vaccine allows and affords people the opportunity to not succumb to coronavirus. They will not die from coronavirus. They will not be hospitalized by coronavirus if they are vaccinated. And I think that's the soundbite and the key takeaway is that during wave one, because of things beyond our control, many of which were structural, there was a disproportionate impact to people of color, specifically Black people. However, in this moment, we do have the ability to shift that narrative just a little bit. And that's why it's so important for us to talk about the real facts around vaccine and to answer any questions to allay concerns. And so the bottom line is I don't want us to die in the wave two, the way that we sadly died in wave one. And I saw that so up close and so personally that is why I'm very, very dedicated to this particular passion project.
Absolutely. Our experience as Black Americans with the COVID-19 pandemic has been particularly devastating. When you think of the way we looked here in Harlem in the spring, I mean, Harlem Hospital, all of our surrounding hospitals, it was horrible, right? It was horrible. And it's really important for us to understand that because of things outside of our control, because of structural inequalities and health disparities, because of structural racism, we are at risk, at a higher risk for this disease. And when you look at our death rates, it's I'll read the numbers off. It's pretty staggering that Black Americans were the second highest group in the United States to die of COVID-19. And then when they look at certain states, so out of 27, so out of a large number of states, New York, New Jersey, and Connecticut being the leading states in that, 1 in every 1,000 Black residents has died. I mean, process that, right? That's 1 in every 1,000 Black people have died just within 27 states. And our tools so far have been mitigation, right? So you want to wear your mask. You want to wash your hands. You want to socially distance, but we now have a tool that can really help us damper this virus down. So it's really important.
Mm-hmm. While we're talking tonight, and I'm sure I had to disappear and come back, technology is amazing. But while we're talking, I'm also going to be paying attention to some of the comments, and I want your response. These are questions I've gotten in the past, but this is one in particular that I think adds to, because what we want to do tonight is also demystify, demythologize the narrative around the vaccine. But someone said that this vaccine is not 100%. Now, I know a response to that, but I want to hear your response. When you hear people say, well, the vaccine is not 100% guaranteed, what are your responses?
Can we tag team on this?
Yeah, of course.
Yeah.
Do you want to start?
There's going to be a clinical component to this that is going to be the slam dunk. But what I would offer you is that the vaccines that folks have taken and that are currently available, specifically shingles, pneumococcal, all flu specifically, they have less efficacy, which means they are less effective at preventing death and ultimate mortality from whatever they're protecting you from than this vaccine. It is important to appreciate that by more than 20% efficacy, these two that are on the market at present, not the Johnson & Johnson to come, but the Moderna and the Pfizer are more efficient at caring for or treating this disease than anything else. And so I just want to always say we cannot be critical of what's newly developed and what's newly introduced when we have been completely intaking many vaccines with live virus, and I think we'll talk about that later, what's in the vaccine. But I just think that we need to talk very straight with people about the things that we currently take and accept and why we are refuting this so badly. What about this is causing such kind of a repugnant response? And that's what I think we should get at, because it's safe. It is safer than others. So go ahead.
Yeah, I did.
Right. So it is safer than others. And that efficacy, 95%, 94, 95% for the two that are available. So if you think of that, it means that out of 100 people, 95% of those people who would have the vaccine are either preventing having COVID-19, or if they are to get COVID, it's a much milder illness. And you really think back to those numbers of our 1 in 1,000 Black Americans that are dying. It's important for us to use this tool to stay safe and to protect our family, to protect our community. And the safety, it's been tested of over 40,000, the Moderna vaccine and the Pfizer vaccine have been tested with hundreds of thousands of people now, and it's very safe. The percentage or the number of people that have died from coronavirus vaccine, right? 0.
Yeah.
But those...
No, I'm glad you said that, because I was doing a radio show for the past 2 weeks, and it's amazing to me how many people will continue to perpetuate false narratives. A person called in that and said, "Oh, I heard 30 people in Detroit died once they took the vaccine. I heard 25 people in the nursing home when they got the vaccine." All like it's countering the myths, right, and countering the false narratives. You can see a question that came up that they just posted for you to look at. How long do we know how long does the vaccine last? And we spoke about this before we went live. What does it mean if you have antibodies and the length of protection? So both of you chime in on that.
So I'll go first. We are encouraging people who have had COVID-19, so those that have the antibodies per the CDC, we're encouraged to get the vaccine. And the reason for that is that COVID-19, right, it's a novel virus, it's a new virus, and we're still learning a lot about it. And we're not sure, the data hasn't tested out how protective you are over time with the antibodies you get. So you've gotten coronavirus and you survived, so you've got some protection. That's kind of your natural immunity. We need to boost that up to be sure that we can make sure that you are not going to get infected or share it with others. So that's that 95% protection.
I think the other thing I would offer around the protection is that this virus mutates. And when you continue to hear words like variants, it speaks to the fact that even the North American virus that many folks had in 2020 is unique from the North American variant that we are seeing right now. You then commingle the Brazilian variant, the South African variant, all of which have coverage under the vaccine, which your antibodies do not protect you from. So the umbrella under which the antibodies that you may have that protects you from, it is that one singular strain that you were infected with before. As that strain has now moved on, it's gotten bigger, faster, more merciless, and then you have its partners in there. You have no fight. And that's what I want people to appreciate, that your antibodies do not necessarily represent immunity from these new strains and from reinfection. And so if you were taken down once before, there's not a one and done deal on that. So if you were taken down once before, you should not think you can't be taken down again. And that is one of the largest things that I think we need to offset.
Absolutely.
Good. Another question someone raised, and I mean, you know, I'm so tempted to jump on some of these questions, but someone asked, are these vaccines experimental? Address this notion versus experimental trial phase versus where we are now.
So when you think about vaccines, the technology that's used for the 2 vaccines we currently have is one that has been used in many other aspects of medicine. It's been used for cancer drugs. It's been used for actually certain other vaccines. And so for the technology, and I hear you, I understand. I remember initially thinking, I'll wait until we have a new administration and until some more testing gets done before I'll take this vaccine. And a good friend said to me, actually, would you rather take the risk of dying or being really sick from coronavirus? Or would you rather take a small risk of getting some arm soreness with the vaccine? Mm-hmm. So I think it's something to really keep in perspective, because it's the risk of dying and the risk of having complications. So just to be a little... really to talk more about my personal experience, my brother-in-law, who is an FCBC member, he passed on April 10th, and we're approaching now 10 months since Zeke passed. He was only 46 years old. Yes, he had some comorbidities, but many people in our population do. And he died. He's gone.
Yeah, I remember that.
And, you know, during that time, I mean, it was devastating. We were grateful that we were able to be there for him to pass, but during his transition, but people shouldn't have to go through that. And the unfortunate thing is, you know, 2 weeks after we buried, well, not buried, but after we memorialized Zeke at Benta's funeral home, my father got sick, and my father ended up getting coronavirus and an infection around his heart and was in the hospital for several days. And I mean, he survived. So I'm grateful for that, but he definitely has less energy, and he's going to have to be on a blood thinner for a good part of his life because of the damage of the virus. So even if you survive COVID-19, you may have blood clots, you may have heart damage, you may be chronically fatigued, you may be just chronically tired, and you may require oxygen. So it's not worth the risk of, in my opinion, it's not worth the risk of getting sick versus the smaller risk of having some arm soreness and a little, maybe even a mild fever after the injection, after the immunization.
Pastor, I think it's important to talk about the science behind the vaccine. So when you hear, and I'm hoping tonight to take some time to translate what people keep hearing so that it sinks in differently. So when you keep hearing about messenger RNA, that is the technology that this vaccine was built upon. And to Dr. Brown's point, this is research actually that was created by a Black woman in the late 90s, and it has been around for some time. So there is nothing experimental about the science behind the vaccine. Messenger RNA technology has been there for some time. It is the equivalent of having a beautifully built plane and just needing a pilot. And so the genomic sequence for COVID was required to mix with that kind of stimulant so that it can be the vaccine. So I want people to understand the science behind it is not new. The timetable around the release of the vaccine, which really is very controversial for folks, is more because the red tape was cut. So I just want people to appreciate that the timetable, the clinical trials, the number of people who were engaged in this research, and at present, I'm now double vaccinated. So I'm a month out from having my second shot. I feel amazing. My mother has gotten it. I think it's important to say that because we need to demonstrate with our behaviors, our support for this vaccine. But it's not rushed. It just had the red tape cut. So there was no need to lobby. There was no need to involve big pharma. There was no need to go through FDA kind of bureaucratic channels. And so what the former administration did do was they eliminated that extra time. And that seems to be the time that people want to feel comfortable. So I just have to offer that there's nothing that no corners were cut on this. In fact, the expedited release was so more people could be prevented, the death could be prevented. So the release was appropriate, the science is sound, and the technology is 20 years old. So all three of those things are kind of myths that we have to debunk just a little bit. And I think that between both our answers, hopefully people feel a little bit more comfortable with the science behind the vaccine.
Somebody one more thing to piggyback on that is that this is one of the few times in the world where the entire world is dedicated to developing a vaccine. And so you really have the smartest people all around the world using technology that's already been around for over 30 years. Again, just kind of plugging in the messenger RNA for this particular virus. And that's why it has such a high efficacy rate and that it's incredibly safe. And I also have received 2 doses. I'm dosed and I'm 3 weeks out now after my Moderna second dose. And both of my parents are vaccinated. My sister's getting vaccinated this week and making sure that my uncle and so my entire family is getting vaccinated. If it weren't safe, trust me, we would not have received it.
Yeah, I'm glad you said what you said, and both of you, because initially everyone said, "Oh, they're cutting corners," and I remember being on a panel and saying the same thing, kind of you said, Eboneta. In my research, it was all the bureaucracy was moved out of the way, right? The research and the science is not new, and when you move all that bureaucracy, the politics, and all that out the way, you are able to get to the people vaccine in a timely manner. So. And I also think, and you all can correct me if I'm wrong, I think there are many people who are watching tonight, for example, who take the flu vaccine. And I think some people think, well, if I take the flu vaccine, I'm taking the same vaccine every year. From year to year, within 12 months, you're taking a new vaccine. So the truth is, many of us know what it is to take a vaccine that gets a 12-month turnaround. Right? But again, it's the fear connected to coronavirus. It's the fear connected to COVID that has us hesitant, because this has traumatized the world, right? And has set us all back in many ways. And I don't know if we got to this or do we know this yet? Is the science out yet? How long does the research suggest the vaccines may last? What do they say? Or is it, and I say that not because, don't take it because it doesn't last long, because again, the flu is a yearly thing. So what is the science saying thus far?
So it's not entirely right. This is a new virus. It's been around for about a year. So we currently think that you will have this protection for at least the next 6 to 12 months. But that, again, is still being worked out. And so it is feasible that you may require a booster at a different time, especially given all the different variants. And just a way to think about the variants is that that the virus replicates a good amount, right? And each time it replicates, there's a chance for it to make a mistake or to change. And that change is what allows it to evolve, which is what allows it to survive. And that's what makes you at risk, right? If you've had it once and then you could get a different variant. So it's very common for viruses to mutate. It's kind of part of what happens with viruses. And that's actually the reason why you get a new flu vaccine every year, right? It's because there's different variants. So they decide or see which variants will be the predominant flu types, and then they make a vaccine to help build your immunity against the most common types of flu. So it's feasible that something like that may be required in the future, but we'll have to continue to watch the data.
Yeah.
And I think the only other distinction to draw is, again, this vaccine has no live virus. So the flu does have live virus where this vaccine does not. So it's just really catalyzing your body to react. And that's what the vaccine does. It says to your body, without introducing COVID, and that's what's so cool about it, without actually contracting COVID, it says to your body, begin to stimulate a response. Begin to start seeing this and fighting this in a way that you're protected. And so that's what the vaccine does for you. And to boost it within 3 weeks or 4 weeks, depending upon your second dose timetable for each of the vaccines, because it's different, you are then getting that second stimulus to basically put you to 90%. And so it is a very calculated timetable, because you're telling your body, get ready to prevent something that usually would cause death. Get ready to fight it in a way where you won't die. And so that's why you have to take 2. That's why that boost is important. And that's why around the second dose, and I want to put this out there, we are seeing more side effects with the second dose, because it's actually kicking your body into immune overdrive. So that soreness around the injection site, that's some fatigue and malaise, or a feeling not yourself. Some people have experienced rigors or a little bit of shakes or the feeling of flu. But what's so amazing about it is that no one has had it for more than a day. It's like they feel that and then they wake up like nothing happened, and guess what? They're protected from COVID. So it's really important for us to figure out what our trade-offs are. You know, is your arm going to hurt? Might you go to bed at 8 o'clock? Or might you die from COVID? And so that's the conversation that we need to have, you know, this or that. And to me, that's what we're trying to draw a very stark comparison here in this conversation.
I want to say, I wish I could give you both a megaphone right now to yell in some way, because you said something that I think is dispelling one of the myths, right? That is extremely rampant in our community. And there's several, and I'm gonna come back to some. But this idea that the COVID vaccine is not a live vaccine. I mean, say that as many times as you can, because I want people to understand it, because that's some of the myths that are being spread, that people are being injected with the virus in order to combat the virus. That's just not true, right?
No, it's not. And the technology is actually pretty exciting. If you think of, for a virus to enter your body and to have an impact, think of it as a key and a lock. That what this vaccine does is it actually gives your body the little code to make the key without you getting sick. So that what happens is your body first sees it and says, what the heck is this? Well, I need to figure this out. Sees develops that little key. And then once it figures that out, it chumps it up and it disappears. But your body has now seen it. So that when your body sees it again in 21 days or 28 days, it is able to mount this really robust response. And that second dose, I mean, I got it several weeks ago. It whooped my butt. It was hard.
I saw your Instagram post about it.
Oh my gosh, it knocked me out. You know, my first dose, yes, I had some soreness in my arm. But the second dose, I mean, I was in bed for a day. And I remember, it was hard for me to lie on that shoulder. And I had a mild fever. I woke up in cold sweats. I was like, wait a second, this kicked my butt. And I was thinking, wow, if that wiped me out for these 24 hours, imagine if I were sick with COVID, right? So the vaccine helped me build the response to seeing this virus. But one day and I was wiped out. It took me a couple of days to really recover from that. And so it's just important I think it even actually gives you a little dose of how bad it could be, right? By having this reaction. And that reaction's great, because what it's telling you is, hey, we saw that with the first dose, and now we're ready to fight this. And we're fighting it really, really hard so that you stay safe. And that's the part where it's like, and that's safe. And 95%, when you look at that, that's pretty phenomenal.
Yeah. And I didn't have side effects. So it's the same way that people play the COVID a little bit sweet, so I had asymptomatic COVID. Well, I had asymptomatic vaccine. So it's all it's all within the same wheelhouse. I wanted to also offer you something, because when we keep saying messenger RNA, I think people commingle that with DNA. And people really believe that their genetic makeup is going to be offset in some way by this vaccination. And I don't have the graphic to share with you, but the nucleus, it's untouched. So that thing that gives you your genetic makeup, the thing that you pass on to your children, the thing that makes you you is your DNA. And this does not engage with, this does not tinker with, this does not alter, modify, or in any way even come into contact with your DNA. And that is what people don't know, because they hear RNA and for whatever reason they commingle or juxtapose the two. So I think it's very important. No genetic impact, no change to your DNA from this vaccine.
Yeah, someone just wrote in the comment, it's when you were talking, it sounds like she had COVID and me with the face. But here's the thing I'm going to say. Think about the baby, and I could be off here. You can tell me, doctor. Think about a baby who gets vaccinations and has a fever and discomfort and pain at the vaccine when they get vaccinations, right? And then it's gone. I test it's the same kind of potential reaction when we're getting this kind of vaccination now, right?
Absolutely. So no, I did not have COVID. I did not have COVID. My body mounted an immune response to stop me from having COVID. So that's something that's very important to digest, that you have to think even when you have your flu vaccine every year, you may get a little bit of soreness. You may have a slight fever. You feel a little under the weather for a short period of time, and then it's gone, right? And that, again, is your body saying, hey, we've seen this virus before, and we actually have the tools to fight it. So what you're feeling, if you have symptoms from that, right? If you have your fever, you have your shakes, anything like that, or even the arm soreness, that's your body saying, we're good. We're ready for you. We've got it. We're going to take you out. And you want that with COVID.
And then, Pastor, to the point that the person felt that maybe Dr. Brown had COVID, this is a plug for testing. You don't have to guess if she had COVID. You go get tested, just like everybody should. And so it shouldn't be mysterious if you think you have COVID. If you're sick, if you feel that you've been exposed, if you just want to establish a routine testing cadence, which I really encourage people to do, then do that. Because the guessing and the, third-hand information about who's got COVID, we don't need to do that. There are testing centers around this entire city. They are free. And as often as you need to get tested, you should do that so that you don't have to guess whether or not you have COVID. Or if you're sick, you don't have to immediately, give yourself the sentence of coronavirus. So I think we should just say, get tested a lot, and you will know whether or not you have COVID.
You should get tested, because 40% of people that have COVID don't have symptoms at all. And so, that's great that your experience is without being sick, but you don't know. You may walk by someone who is compromised and they get COVID. So it's really important to know. It's almost like back in the day when they would say, know your status. You should know your COVID status as well. Absolutely.
Let me act like I'm a medical professional for a second, because someone asked a question and said, should someone who has antibodies still get vaccinated? We kind of talked about this earlier, and this is a question I kind of alluded to. So I had COVID, and I have the antibodies still, but as Ebony and Ide alluded, that rhymes. It does rhyme. It sounds good. And so as both of you said, there are so many different variants at this point of the coronavirus, that just because you have antibodies in reaction to an early strain of the virus doesn't mean that you're fully protected. And now, although the science is not fully out yet, we do know we can't make those assumptions. And so some of the questions that people are asking are questions that are still being answered in many ways. How long does the vaccine work? Does it mean I'm prevented for life from coronavirus? These are things we still are being researched. One of my doctors said to me that, I think it's something like 7 kinds of corona, well, early on as of last year, but they know the ones that you build immunity, they know the ones that you don't. And what he said to me, and what my immunologist also said, is that it's still early in the research. There's some things we just can't answer right now. So there's no slight on the vaccination or the health care industry, it is early. We have gotten blindsided by a pandemic of epic proportions that we've not seen in our lifetime. And the testimony to modern science is the pace at which we were able to develop these vaccines in a way to prevent the deaths. And I will tell you what, that this vaccination and people getting vaccinated is going to stop these deaths and stop the spread of COVID-19. Secondly, there was another question, and I want people to hear this too. And the reason why I have these two amazing human beings on this program with us tonight, when you hear people, this person said, well, why is it all of a sudden that the country is pushing African Americans to get vaccinated? We've never been that concerned about African Americans getting vaccinated. Well, it's not certain people. On this screen right now are 3 African Americans, and across the country, there are many African American health professionals and people in churches across the country who are pushing this. Why? Well, it's not rocket science. We are disproportionately affected by this. We are dying at a higher rate from the virus, and that's why we're pushing this, in our communities. What do you want to say to that, to those kind of things?
I would say, sorry, I wanted to say absolutely. So there is a research group, and they found that when you look at the numbers of Black people versus white people dying of the coronavirus, it's 2 to 1. So for every white person who dies of coronavirus, there are 2 Black people who die of coronavirus. So we are dying at a rate of 2 to 1. 2 to 1. I mean, really digest that, right? And our vaccination rates, just looked, our New York City numbers, and white New Yorkers are actually 4 times more likely to get vaccinated than we are. So we're twice as likely to die and less likely to get the vaccine. And I understand why. If you look at our history, you look at the Tuskegee experiment, you look at, I understand the mistrust of healthcare, and I'm a physician, I get it. But the science for this is good science, and you should go to people that you trust. Pastor Mike, who doesn't trust Pastor Mike, right? You seek guidance from those areas, those community, whether it's a fraternity, sorority, or your faith-based organizations, or your healthcare provider, or your community groups. Those are where you can start to talk and ask these difficult questions. But it's just so important for us to get vaccinated because we are dying at twice the rate of white Americans.
Thank you. I am a pragmatist always. And so I want to share with you that the country is spending way too much money on the coronavirus pandemic for them not to care about the disproportionate death, which equates to a disproportionate spend in keeping people in ICUs. And so this has become the most costly thing that the country has been faced with, because medical professionals are actually dying because we're caring and treating for people who are dying from coronavirus. And so the number of people available in the healthcare profession is quickly dwindling, if not by virtue of people who are getting sick, but by virtue of people who are retiring, because the psychological impact of COVID and of the mass casualty that we've seen has had people exiting the healthcare profession. So number one, it's very costly. As people die, now you can get diabetes a ton, you can be overweight a ton, you can have all of the things that we use in grad school to talk about healthcare disparities. But when you begin to consume ICU beds, when you begin to consume $10,000 a day on remdesivir and all of the things that we have to do to treat you, and we have to spend money on traveling nurses to come from all over the country and pay them double what we pay our good, hardworking nurses because we're so overrun, it becomes a national imperative. So that's number one. I think if I were to say really, why is everybody looking? Because the country can't sustain itself with this number of people dying in hospitals. The second thing is that the level of advocacy around people of color has improved significantly since Tuskegee and since the experiments in South America. And so we have wonderful people, including my fellow trustees, people like Arva, that are advocating for equity. And as people are saying, look at us, hear us, appreciate us, then they're saying, then help yourself and come and survive and be a part of a group of people who are aware and educated about what this is doing. So I think this is the right time for us to challenge ourselves and to actually acknowledge the fear, acknowledge the dark history of medical experimentation in this country, and then say, but this is different. There's nothing that's the same about getting this vaccine and people who have been upset about being injected with syphilis in the 70s and 60s. That's different. Both real, but different. And I think we just have to appreciate those differences because we don't have a lot of time left, or we'll keep dying.
Yeah, I think that's the most critical part. We acknowledge the historic, barbarism that was committed against African Americans. We can acknowledge that. It is not. It is not a betrayal of history to now advocate for the vaccine. You acknowledge the history. You acknowledge the legacy in this country, a long legacy of medical racism, right? And how it has played out. But at this moment, we have to not let that go. But now we move forward with the right information. We have an opportunity now to make choices, right? There's some people who will decide not to take this vaccine, and there will be people who decide to take it. What we want to make sure is that with all the decisions we make, with any choice you make, that you are making an informed choice, right? And that becomes important and critical in so many ways. So I think someone said that well, let me add this. A few weeks ago, Wadley School here, which is a few blocks away from FCBC, was vaccination site, right? And one of the deacons of the church came to me and said, listen, I just left from Wadley. The line at the school was down the block, right? And the person said that over 95% of the people in the line were white people.
Mm-hmm.
Okay? In the line on 114th Street between 7th and 8th, that 95% of the people in line were getting vaccinated. Let me be clear that and just for those who still have those fears, I don't think they pull out the vaccine kit, the fake one for Black people and the real one for white people. Okay, I see these are the kind of things you got to say, because there are people who believe that all of a sudden when they see a Black person coming, we don't give them the real deal. We give them something else to make them sick. But when the white person comes, we don't give them the real deal. That's not the case, right? Here's what I said, and this may be a little facetious. I said, but a whole lot of us are going to be mad in a few months, right? When things start moving forward and things start happening, you're going to have a whole lot of white folk living their best life because they got vaccinated to a degree. And we're going to be sitting back looking like what happened because we didn't. Because here's what I'm convinced of, and you all tell me if you agree. I think as more of the population, the global population gets vaccinated, and there's some recovering made with the economy and different sense of normalizing activities, I think in the future, for travel, they're going to ask for the record of your vaccination.
Absolutely. Absolutely.
So I think, Pastor, what you just challenged me to think of is that COVID can easily turn into hypertension as a chronic disease that impacts us if we don't participate right now. And so COVID is not going to be something that kills people forever. It is something that is going to be contained. It's going to be something that those who are vaccinated are protected from, and then those who are not are going to be here. And maybe that won't be racial. Maybe that will be education-based. Maybe that will be stratified by your economic status. But I really want people to appreciate that COVID's going to keep living. And if you are not vaccinated, COVID will keep impacting you, but it won't impact everyone else. And then you can't be upset. Then you cannot feel unequal if we are disproportionately impacted in perpetuity. And that's the only thing that I want people to appreciate, is that we have an ability to make a change and behavior something different for health equity. And that's what I really want people to appreciate. No coercion. Do what you need to do. However, don't be an active participant in a disparity. And that's what we need to talk about.
Make an educated choice. Get the facts, the real facts, from trusted sources like the CDC, the World Health Organization, even our own Department of Health. And that's when you make your decision. But you can't, there's a lot of misinformation in our community. And unfortunately, it's costing lives. And what you're seeing is that that the white community is using our vaccine sites in Harlem because we're not using them. We're not using them. right? And they are. And those vaccines, our community is disproportionately affected, right? 2 Black people die for every 1 white person that dies of this disease in the United States. And we need to have the information so that we can make the best choice about whether you want the vaccine or not. I mean, one thing that I would mention is just that we need herd immunity, right? So what does that mean? It means that we need a certain number of people to have the vaccine in order to be protective of our society. That number is somewhere in 70 to 80%. So if you think of that, think that for every 100 people, for 100 of us to be safe, we need 70 to 80 of those people to have the vaccine. So you're not just getting the vaccine for yourself, but you're getting it for our community. We're getting it for Harlem.
I would just offer, you're right, Pastor, the first couple weeks that we made available vaccine at Harlem Hospital, 97%, and I'm probably understating, 97% of the people who came were not people of color. People who didn't have a medical record number associated with our hospital, many people who drove far distances across multiple zip codes to get here for that thing that they wanted so badly, that they are offering us money. And so while we are pleading in some cases with folks to take this vaccine, others are trying to buy it. They have robocalls coming in so that they can try to scam the text system and the platform. They have their help staying online all night long, getting appointments deep into the midnight hour, because that's how badly they want to survive, and they want to return to normalcy, and they want to see their grandchildren, and they want to travel. And I want us to have that same passion behind our restoration of normalcy. And we understand that this is, to Dr. Brown's point, the key in the lock.
Now, there's a comment here. I'm going to address part of it, but I want you all to address this if you can. This person says people's DNA responds different, and I feel we need way more info before we decide to inject ourselves, not fear that what if, or go with conspiracy theories just to make an educated choice. Don't think because white people get it, it's great. Geez. Now let me say on my part, this has nothing to do that because white people do it, we ought to do it. I want to be clear about that. What the point we're making is that if we're not getting in line for the vaccination, others are getting in line. That's one. Two, when you say we need way more information, that's why we're doing this now. Information is not going to drop out of the sky and hit you in the head. You have to seek the information, and when people make it available, we have to make sure we're learning. No one see this is part of, I think, this age is that this is the spoon-fed age, right? We want everything to be hand-delivered to us like Amazon. We want everything to be downloadable like social media. We want to be able to post everything like Instagram. There are still things that we must do our own work and research to study, to see, to learn before we make these choices. What is interesting is that, and I know it's not a good comparison, but there are many people, as alluded to earlier, we don't necessarily, and it's not justifying it, but we don't study everything that we have taken. We've gone to doctors, right? I was on steroids for years because of a misdiagnosis by a doctor that led to me now having thickened heart valves and high blood pressure, right? And I have these medications that I take because of that, right? I took the medications because I knew what I was feeling. And I'll be honest, when I first started, I didn't go online and do all this research. I didn't question what's happening. My assumption was the doctor was giving me, and we do this all the time, the doctor was giving medication that was necessary and would help, only to find out that some doctors weren't doing their due diligence with regard to my condition. So this is not just about COVID-19. Don't let the trauma of this, don't let the what we're seeing daily now, the deaths are real, lives are real. We have people, 3 people right now, a healthcare administrator who sees this daily, who has to pool resources to combat this disease. We have a clinician who's faced this, who's also experienced loss in her family and death. You have a pastor who I had to battle COVID-19 and was sick for almost a month with this thing. So we're not here, trying to push the latest ideas. We're here out of a sense of urgency because we don't want to see our community continue to suffer. We don't want to see people of color continue to pass away. So With that said, speak about one of the issues. I know, Ebony, you can address it first, then Ide. This notion of access. When we do know there's a reality that less African Americans, people of color, are seeking to get it. There's also this reality about access, and I know this is something is of concern to you as well.
So the 30-second response to your prior comment. Tell me what way more information is needed. That's my answer to that. I had a morgue truck that I had to build shelves on because I had so many dead bodies that my morgue was overrun and that the city had so many dead bodies they couldn't pick them up. And so it was with respect, but we built shelves in morgue trucks, 3 morgue trucks on the campus of Harlem Hospital. And that's how we had to handle what they call decedent affairs. So these are real people, all of which looked just like us, that already passed away. And so my question would always be, way more information like what? And if you have lists and if you have questions, then we should talk. But way more information doesn't really help appreciate where to go to find and pull for those resources. So ask your questions so that we can help inform you. And that's what we want to do tonight. What I would say around access is currently in the city of New York, you can only obtain an appointment for a vaccination through a web-based scheduling app. There is also a phone number that has been provided that drives you to that same web-based scheduling app. And because of supply, quite frankly, I think that getting an appointment, if you want it, is very difficult. If you are a person who has who doesn't have high-speed internet, who may not know how to navigate multiple screens, who may not have their own device, who may not know how to get to the vaccine sites, access for you is not only limited, it's outright not available. And so what we have tried to do at Harlem, frankly, is create a separate glide path for people who live in this community, who would help to foster both that internal and external herd immunity, and we're making space for them. We're simply carving it out and manually entering them into our vaccine registry because there is no other way for them to get there. So what I would say is, right now, the elderly in our community need our help. People who want to come can't get an appointment. And so I'm very grateful for many of our elected officials who I know are advocating for this on our behalf. But every day there's a slow and steady churn that comes through my hospital that we're making appointments for because there's no other way. There's not a phone number, and the Vax scheduler is not ideal, but we are still making a way, as I think are all hospitals in New York City. So access is an issue. The eligibility criteria as of next week is going to be wide open, because right now it's healthcare workers, unaffiliated healthcare workers, all restaurant workers, patient-facing, people-facing positions, teachers, those that have high traffic, and then comes chronic comorbidities next week. Next week, as of February 15th, it's us. And so the ability to get this is going to be unobstructed where there's access. And now I just want people to have as much passion behind seeking their appointment as do other demographics in the city. And that's all I want to accomplish in this conversation. Go find the appointment if you want it. And if you can't find it, there are many community-based organizations, including Harlem Hospital, that are trying to create those inroads. But they don't exist at present. And it's really just a few people who are trying to help, which is very problematic.
Yeah. Yeah, I'm looking at these. Another comment, and it says, "I'm a researcher by nature, so is there a place one can go to get information?" So let me pause for a second, and I hope the person who asks it takes this the right way. I'm passionate about this because I don't want to see our people continue to suffer. I don't want to see anybody but our people. Your statement is, "I'm a researcher by nature. Where can I go?" Okay. Before I came on tonight, now I've been looking up information about the vaccine for myself. I suffer with, I have an immunodeficiency disease, right? And I went on a search for about an hour. Within an hour, I got information from the National Medical Association about the work they've been doing to make sure that African Americans are getting the right information, and also the work they did to make sure that for that, which if you don't know what the National Medical Association is, it's really African American Medical Association. Make sure that this was safe for our people. You can get the research, you can find the information, right? And I want to be mindful. We have technology. Hold on. If nothing else, you see this. This is not for playing Candy Crush, right? and texting and phone calls. You can tap into libraries. You can tap into scientific journals and articles with this phone in your hand. It is possible. We have to be diligent about our desire to get the information, right? So that we can make, again, what? Informed choices in this moment. So I think the idea, as Ebony said, that in her work as the CEO of Harlem Hospital, this is a no-brainer because alternative is backing up more trucks, right, to the hospitals. And we know what it looked like. All we have to do is think in our minds, what did last March, April, May look like? Now, here's the thing. Here's the amazing thing. Those months were hectic. Why? It was coming. It seemed so fast. You know, hospitals were filling up. People were terrified. But and correct me if I'm wrong, January, this past January, without all the panic and the sensationalizing of the issue, had more deaths in the month of January this year than at the height of the pandemic. So what I also want to let people know is that last March, April, May, June, there's a sensationalism by the media. This thing is ravishing us. But we had this year more deaths in the month of January than in any other point during this pandemic. This thing is not easing up. It's not on pause. The pandemic didn't say, oh, it's 2021. Let's stop now. It's a new year, right? For the people who believe that 2021 is going to bring something different, like the virus is on a calendar schedule, right? We have to be diligent in the work we do and how we go about this. I saw a question earlier about, and this is some practical questions. I get a vaccine at one place. Is something wrong with getting the second one at a different site?
Yes.
Okay.
So it throws off the allocation. You are actually designed to get your first and second shot in the same location because of allocation purposes. So when the state actually distributes each of the vaccinations, it's in a lot or a tray. That lot is designed to basically facilitate first and second doses. And so that's why you are supposed to get your second dose or your second dose appointment the day that you come for your first, so that you can appropriately be timed either at the 21 or greater or 28 or greater timetable. So you really should, because it will throw off other people's ability to get both doses. You should, and it's mostly required that you get vaccinated in the same place. The only exception is if you were in another state prior and you got your first dose there and you're within the window in New York, then certain concessions can be made. But you should and you will be made an appointment real time when you go for your first dose.
Yeah, I want you, and we talked about the sense of urgency, Dr. Brown. Talk about, and I know we see news, we see stories in the news, we read articles, and I'm going to go back, not to the vaccine. Talk about what it was like as a clinician when we saw COVID-19 ravishing our communities. What was it like as a clinician being part of this? The weight, the emotion. What was it like?
It was really, I describe it as harrowing and daunting and very, very humbling, because this is a new virus and our traditional tools to take care of this type of illness weren't really that effective. And also that people came in and would look okay. And then you would check their oxygen level, and their oxygen level, you're wondering how they are standing, right? And I mean, I give one example of a patient I took care of back in April who actually survived, but he came into the ER speaking, walking. He came because he had folks in his house that were sick and he just wasn't feeling well. And over the course of 4 to 6 hours during that shift, we ended up having to put him on a breathing machine. We had to put him on life support. And I mean, this disease it's brutal. It is brutal. It's unrelenting. And it's something that you said, Pastor, which was, well, it's especially back in the spring, it was hard because people were passing away and you could not have their family close by. Mm-hmm. And just the number of people that was passing away, just how many, I mean, one floor I was on one night, we lost literally just a part of, right? So the part of a hospital, one floor we lost 6 people. 6 people, just one floor of a hospital. And that was happening every night. It's devastating because we go into medicine and we go into healthcare because we want to help people and because we want you to have better lives. And we were beaten up. I mean, so the physical and the emotional toll for all of us has been very, very devastating. So this virus exactly did not say, oh, it's 2021 and we're done. Or, you know what? I'm tired of wearing a mask. Hey, I'm tired of not going out to eat and sitting next to my friends and, smoking a hookah or whatever. The virus is like still going. And if anything, it's becoming more aggressive in infecting people. So we have to stay vigilant. And we really have to take in all these facts and get protected because it's devastating. I mean, I'm grateful that we were there when my brother-in-law transitioned, but I was also there for many patients who did not have family there when they transitioned. And it is even beyond that, just the ability to congregate for a funeral. I mean, our funeral could only have 7 people.
Yeah.
Right. It's just, it has taken, this virus took away from us all of our traditional ways of dealing with death in many respects. And now we have a way to come out of that darkness.
Yeah. Yeah. I want to tell you, give you a heads up, Dr. Brown, that a mutual friend of ours is on. I see her in the comment, Dr. Sonia Sloan.
Hey, Sonia.
Is on, a good friend of ours from Houston, Texas. And they just give some, from your perspective, because there were many days where I would check on you and pray for you because I knew the pressure you were under. How have you been able to actually deal with the kind of toll, the emotional toll, having to face this, having to be a source of support for doctors and nurses? How has that been? And how have you been kind of tending to your own emotional well-being in that regard?
So I'll tell you, Pastor, I'm very rooted in my faith. And there's, it was back in April, I Am a Warrior, that sermon. I listened to that sermon hundreds of times before we went to the hospital to take care of people, before we went to the hospital to take care of my own family when we thought we were going to lose my father. Really, really rooted in my faith and really still trying to keep hope, to stay hopeful that when you think about it, if you take a step back, in the course of a year, we have a way out of this, right? Which is the vaccine. And so I'm a bit optimistic about that, but really it's staying in the present, trying not to reflect too much of what happened and staying in the present and being really rooted in my faith. Because that's the only way I've really made it.
Yeah.
I think I want to share what we're doing for others. And then I want to just be a little bit vulnerable about, that it's okay to not be okay. So number one, at the hospital, for people who have continued to see death and dying so often that it's become normal, people mopping up blood every night doesn't need to be something that doesn't impact them. So we can't normalize trauma. And I think that's what a lot of us have done in healthcare. We are powering through because every day we keep being told we're essential workers. Who is going to care for the patients if not us? But we're burnt. We are absolutely, and I'm just speaking for the hospital here. It is grueling. And so we've been working nonstop 7 days a week for over a year. And so even with the downturn, we had to figure out how to get the hospital back up. So while everyone was taking a pause and COVID's gone, now I've got to get my ORs back. Now I've got to return ambulatory care visits to being in person because we moved heavily to televisits and video visits during the height of the pandemic because we didn't want people to interact. So the conversion back to normalcy and then to the second wave has actually been like going into second and third gear, and we're running on empty. So we have a program here, it's called Helping Healers Heal, where we create battle buddies. We have people who do standing debrief just to say, I'm here for you. Some of it was about getting people groceries during the pandemic because they're working so long and hard that they can't get home and do certain things. So I think as a hospital community, we've done a decent job of just acknowledging the chronic fatigue and the trauma that's happened. But as an individual, as most women know who are mothers and most men who are fathers, I'm pouring from an empty cup right now. I'm absolutely disclosing to you my truth because you asked. And so, I worked 7 days last week. I could not get out of bed on Monday morning. I just couldn't. I couldn't wake. I couldn't move just because Saturday and Sunday I worked the vaccine pod, getting the people that look like us appointments because I was tired of seeing 95% of the people in my lobby who would never even cross my threshold normally coming for vaccination. So I'm tired. What I am going to do is recognize that fatigue and then try to offset it with some form of balance. And it's not going to be enough, but it will be better than nothing. And so I just encourage people to know your guardrails, know your triggers, know when enough is enough, and it's not being a quitter. Take time for yourself. It's okay to tell people don't call you. It's very fine to say, I need these 2 days or I need this space. So right now, I'm just offering that we're still in the process of coping. But I do understand that approaching the wall is better than crashing into it at 100 miles an hour, which would have been my truth last year. So
that was so beautifully said. I mean, you really have to be okay with saying, I'm not okay. You have to all be vulnerable.
Still highly functioning. So to resilience, right. I'm on 100 every day. So my 50 is still 100, but I have to know when is my when. And for highly performing people or type A's or folks that like to always just push, don't, because you can push too hard.
Let me say this. I want to, and I'm sure our producer will look at this, a comment by Christina Dozier, and I hope people hear this. This is a powerful statement she makes. She says, it's not fair to our essential healthcare workers who are severely strained for us to not be thoughtful about our COVID-19 vaccination decision. That to me captures what it means. If you think about FCBC and our theme last year, 2020, it's amazing that at the end of 19, that theme came to me, it's bigger than you, right? And that's the theme. When you think about this decision, think about people like Dr. Brown and Ebony Carrington, who are in the field, who are in the hospitals, who went through that early first wave, who are now dealing with the second wave, and who don't want to see more of our people die. But also think about the strain on our health medical professionals right now when we make decisions not to be vaccinated based on myth, based on misinformation, based on conspiracy theories, based on lies. Informed decisions become critical because here's the deal. If you never thought that we were living in a truly global world in terms of contact, think about the nature of our conversations. The world is fighting this. For more than that, we're sitting here right now. We're in New York City. But we're talking about a Brazilian strain, a South African strain, a UK strain. There was a time we would have heard this and dismissed it. Oh, that's over there, right? I remember how many of us, when Ebola was coming, we was like, oh, that's over in Africa, or no, that's not going to impact us. That's over in China. Think about us in the days where we would see Asians and some Asian Americans walking around with masks and made fun of that, right? Because we didn't have their reality, especially in Asia with different pollutants in the air and things like that. Now this is our life. So we are here now talking about the global impact, the impact of strains that are emerging and emanating out of other parts of the world that are impacting us in New York City. Right? So this is not regional. So when we say global, we mean global. I want to end tonight by not ending now, but come back to some practical things. So a question earlier, I want to address it. And I just want you all to hit it how you need to hit it. The person said, if I have COVID, can I take the vaccine?
You can take the vaccine after you've recovered from COVID.
Okay.
And you should. Or we recommend it. The CDC recommends it.
Good. And for those in my case, let's get personal for me. Let me ask you one more question. I forgot. I didn't want to forget this. What about people who are concerned about anaphylactic reactions?
So yeah, go ahead.
Within the vaccination process, there's a 15-minute observation period that is designed to monitor you and observe you after you've received the vaccine for exactly that purpose, to make sure that you don't have signs of anaphylaxis or diaphoresis, or you're sweating, or you basically have any kind of cardiac issue. So that's what the 15-minute observation period is for. Individuals who have had anaphylactic reactions and responses to vaccine, it's a question that they ask on the front end. And if they say yes, then we say, talk to your doctor, maybe bring your EpiPen. So usually this wouldn't be the first time that you would experience that. And then the second thing is, in most cases, there's a crash cart, meaning there's something that can deliver rescue medications and resuscitation to you in the event that anything untoward does occur. And so these, even in mass sites that are in the community, the healthcare professionals there will be able to address your issues, but it is that for that reason that the observation period was built in, and it's a required component of the vaccination process.
Mm-hmm. I want to say that louder again, because I know people are going, I want to hear that. So for people who are worried about allergic reactions to the vaccine, once you get the vaccine, there's like a 15-minute period where they observe you to make sure there is no reaction. And in the case of that there is a reaction, I like evidence. We see the crash cart.
Yes, it's called the crash cart. Yes.
Called the crash cart, yeah.
Like crash carts don't crash. So right, so that they can treat you quickly. Back to another practical question. Is there a 90-day wait after COVID to take the vaccine? I talked about this. So is there some, I saw a few people make this statement. Have you heard that yet? Is that true?
No.
No.
Dr. Brown just shared that if you're actively positive by PCR test, then it is advisable to wait 2 weeks after, so that you are not actively shedding virus when you receive your vaccine. But the 90 days, I've heard that number floated as when you really hit the highest portion of your immunity after your second shot. That's the timetable that I've heard after second dose, that you're really set. But it actually begins 2 or 3 weeks after you've gotten your second dose. So but there was another question, Pastor, about commingling flu vaccine and COVID vaccine. And so some of the questions that you'll be asked if you do decide to endeavor towards vaccination are, have you received monoclonal antibodies within the last 90 days? And that's also a treatment for folks that are COVID positive. They would like to know whether or not you are actively COVID positive, or if you've received any other vaccinations within the past I want to say 2 weeks or 30 days. It's escaping me, but that includes shingles, pneumococcal, or anything else. So they do not want you co-vaccinated at the same time. So if you do have flu and you want to get that, then you should wait, and then you're in the window for COVID. But you should not get them at the same time or in a similar time window.
And these are all built into your screening for the vaccine. When you schedule your vaccine, you answer these questions. And also when you present for your vaccine to actually in person to get it done, that's the questionnaire that you're filling out. They ask you that. So there are steps within the process to make sure that these episodes wouldn't happen.
Also, I saw two similar comments of persons who have elderly parents, grandparents, who took the vaccine, had the first dose, and are sick, feeling weak, vomiting. Like, can you kind of talk about that as well to kind of ease the fear connected to that?
So the point of the vaccine is to prime your immune system, right? So what you're doing, the vaccine is telling your body this is something that's dangerous. And then your body is learning after the first shot, and then using that response really after that second vaccine, the second shot, is to fight it. And so what you're feeling, or what some people feel, so for example, I had symptoms after my second vaccine, Ebony did not, right? So there's variability. But that little reaction that's your body saying, hey, we've seen this before and we're whooping its butt. That's your body's immune reaction. So you have that for a short period of time, and then those symptoms go away. Mm-hmm. So it's to say that your elderly family member who had a sense of the fever and such, that will go away. And it's a good sign, actually.
And watch it if it happens for a long time. And what I want people to appreciate is the vaccine, after you get it the first time, 3-4 days after that, it's not a panacea. It's not going to protect you immediately from COVID. You still can contract COVID. And so people have to be very, very careful. I watched a woman leave and she like threw her mask off and she was like, I'm safe now. And I said, put the mask back on, because it was like in the arm, now I'm safe. And so I want to make sure that we say to folks, you must wear your mask forevermore. You must continue to do all of the things that prophylactically protect you from COVID. And you have to realize that some people are going to get sick. Older people are going to have things that are going on with them. And I want you to make sure you don't commingle the two. So if your elderly family member is sick for a long time, take them to the doctor. Always go check. Be very responsive to the things that people are sharing with you, and just be as cautious as possible. So don't stay home and just watch.
And I just want to reiterate what Dr. Brown and Ebony both just said, that if you have a family member who's taken that vaccine and they get ill, don't sit back and start blaming the vaccine. Say, oh, see, I shouldn't have taken the vaccine. If it continues, you go to the doctor, but don't make that correlation and say things like, we know we will do. Oh, I'm not going back for the second dose.
Yeah,
I'm not going to take my family member back for the second dose. Don't do that. You want to complete it. As Dr. Brown alluded, it's actually a good sign when you're getting those symptoms, because it says that your body is working now, right? It's reacting, it is being stimulated, and you're developing the immunity. So that is good. Do you know if there are any known negative reactions to HIV medications?
That I'm unsure of. But they're encouraging, the CDC has recommended that everyone in the certain risk groups to get the vaccine when you're eligible for it.
Okay, good. And I'll give you each your time, because here's what I will say. If you promise me, both got to promise me that you will come back, because I got a feeling that we will have to keep having these ongoing conversations. And what I really want to do, and I'll just say this now, put you on the spot, hold you accountable for this, is not just this COVID. Part of what I want to do in the future is have ongoing conversations, because one thing that we became very clear at the onset of the pandemic was it raised it shined a light on the disparities in our community, right? The health disparities in our community. And I want to have ongoing conversation around wellness and health issues, and conversation I think we ought to make part of the work we do as community of faith anyway. But I want to have ongoing dialogue, and not just about COVID, not just about the vaccine, but other issues that impact, because you alluded to, Ebony, that, that this COVID can be a trigger for some and actually cause hypertension, can cause high blood pressure. We know the psychological impact of COVID-19. We've seen, they said about 65% of Americans have all experienced depressive symptoms during this time. And some may not be clinically diagnosed as depressed, but many have experienced depressive symptoms. And so this is important. I'm gonna give you each an opportunity to get some closing statements with regard to the vaccine and your role and what you think, just some closing words of encouragement to those who are, on the board of whether or not to take the vaccine.
So I'll go quickly. I feel like I've talked a lot, and I've really said what I wanted to. We are here, so I am here as your trustee, as your sister in Christ, and as a community leader of a hospital to say I remain ready to answer your questions. On all these platforms, we avail ourselves to you because knowledge is power. Inform yourself, ask your questions, research, lean into your fear and own it, but don't let it cripple you. And so, faith over fear to me is the message. We've watched people die from this, and I don't want to keep watching that. And if there's something that is really striking in you that says, I don't want to do this, and it's for fear, then let's talk. Let's talk as often as necessary, because I really don't want a person who's open to getting this not to have space or room because of fear. So I would say it's real to be skeptical, but don't wait too long. Measure your response, get your research, and really stay safe, because some of the behaviors that we're seeing are because we're not complying. So if you live with an elderly adult, please wear your mask. Don't go out and party and congregate. You're putting them in harm's way. And then if you are in any way resistant to vaccine, you are creating a problem that you're not contributing to the solution at all. So I would just say use the tools that are available to you. We want you to stay safe, and we're so thankful for your time.
Dr. Brown?
She said that perfectly. I would say, faith forward, right? That you get the information that you need, and you have sites on the internet, you have You can find me on Instagram. There are multiple ways to get the accurate information about this vaccine, and know that this really is a tool for us to emerge from this period. This is a way for us to enter a new normal, but it really is, it's patriotic. It's a service to others to become vaccinated, because you are, yes, protecting yourself, but you're also protecting your community and those around you.
Yeah. Thank you. And I would just add that one, I want to thank both of you for doing this tonight. You all were both so gracious in the willingness to do this. But at the end of the day, it was about us getting some information out there. This is not going to be the last conversation about the vaccine. We're going to have another conversation, because there are a lot of other questions that will continue to come up as time progresses, and as more conspiracy theories are generated, as more, myths are created, as more misinformation is shared and spread. So we'll have to continually be able to combat this by educating and informing. And that's what I think part of the work we're called to do in this season, is to make sure that we share the information that's going to allow people to make, again, informed decisions, and at the same time in spaces and in places that we learn to trust. We've come to trust the church. We trust medical profession that we know, that we can relate to. And so I'm grateful for both of you. And also for those who have raised this question, like our TNTs, this conversation will be, I believe, and John Leslie, our producer, can tell me if I'm wrong in the private chat, but I believe this will be saved on our YouTube channel, and we will make sure of that. So John, you can tell them that. All 3 platforms, it will be saved, even the web, yes. So this will be saved on our YouTube, our Facebook, our FCBC, on our website, fcbcnyc.org. You got the app, you can do all that. So all of our platforms, this conversation will be saved, so you can direct people to go listen. You may have family members. Who have these same questions. There may be other people who have concerns about the vaccine. And this is not the end all and be all conversation, but at least it's a place where we can start to get the right information to really combat this virus and to reduce the death rate, not the sickness, the death rate in our community. So both of you, I thank you so much. So grateful for sharing with me tonight, and expect a call, email, text again when we come back and do this. And I promise you we'll do that, because we won't stop having these kind of conversations. You will be our resident health correspondents and commentators for FCPC TV.
And our names rhyme, so we have
Yeah,
that thing going. So
That's right. Every day. I like that. Every day.
Exactly.
You'll be the crew, and I'll be the DJ. So, listen, everybody, thank you for joining us tonight for this informative conversation, speaking the truth, debunking the myths, demythologizing the narrative around the COVID-19 vaccination. And until we meet again, make sure that we live, we love, we serve. God bless everyone. Good night. Take care.
Night.